Sample collection, handling, and processing for coagulation testing. Non-traumatic venipuncture. It is essential that trauma be avoided because it may introduce tissue thromboplastin that would activate coagulation. Order of draw. It is important that proper order of draw be followed. Collect the tube for coagulation testing before any tubes containing heparin, Aptt, sodium fluoride, or clot-promoting additives. Use plastic or silicone-coated glass tubes. Plain glass tubes will activate the intrinsic pathway, including the activation of the contact factors prekallikrein, 11, and 12. Ratio of blood to anticoagulant. The ratio in blood collection tubes is critical, and it must be maintained at a 9:1 ratio of blood to 3.2% sodium citrate anticoagulant. Otherwise, excess citrate will bind calcium chloride in the reagents for PT and Aptt, causing falsely long coagulation times. Specimen processing. Specimens must be processed as soon as possible following blood collection. Recommendations include processing within 4 hours for Aptt and 24 hours for PT. Centrifuge to obtain platelet-poor plasma and remove plasma from cells. You can freeze plasma at -20 degrees Celsius. Temperature testing must be performed at 37 degrees Celsius. Enzyme reactions work best at 37 degrees Celsius. Labial factors Vi and E8 will break down at temperatures above 37 degrees Celsius. Factors 7 and natriuretin will be activated at cold temperatures. Evaluation tests for secondary hemostasis. A. Activated partial thromboplastin time, or Aptt. It is a screening test for factors 12, 11, prekallikrein, HMWK, 9, 8, 10, 5, 2, and 1, which are part of the intrinsic and common pathways. It also monitors unfractionated heparin therapy. There are 2 reagents needed: a platelet phospholipid substitute with an activator such as kaolin, selete, silica, or ellagic acid, and calcium chloride. The principle involves adding the phospholipid and activator reagent to citrated platelet-poor plasma and incubating it to allow for contact factor activation. Then, calcium chloride is added, and the time required for clot formation is measured. Normal and abnormal controls must be run, which is essential for quality control. The reference range is 23 to 35 seconds, established by each institution. A prolonged Aptt can indicate factor deficiencies in the intrinsic and common pathways, where factor activity less than 25 to 30% will prolong the Aptt. It can also be due to acquired circulating inhibitors, such as heparin, lupus inhibitor, or an antibody to a specific factor. Sources of error include improper sample collection, preparation, and inherent patient problems. For instance, a falsely long Aptt can result from a blood collection tube not being full, a large clot in the tube, heparin contamination from a line draw, hematocrit greater than 55%, and lipemia or icterus, especially if an optical method is used. A falsely short Aptt can be caused by hemolysis, a small clot in the tube, or plasma containing platelets rather than being platelet poor. Incorrect reagent preparation, such as incorrect dilution, water impurities, or improper storage, can also be a source of error. Instrumentation problems like issues with temperature, light source, or bubbles in the sample can affect the results as well. B. Prothrombin time, or PT. It is a screening test for factors 7, 10, 5, 2, and 1, which are part of the extrinsic and common pathways. It also monitors anticoagulation therapy by vitamin K antagonists like warfarin or coumarin. The reagents required include a thromboplastin source, which is tissue factor, along with calcium chloride. The principle involves adding the thromboplastin reagent containing calcium chloride to citrated platelet-poor plasma and measuring the time required for clot formation. Normal and abnormal controls must be run, which is essential for quality control. The reference range is 10 to 14 seconds, established by each institution. The International Normalized Ratio, or INR, is a means of standardizing PT reporting worldwide and is not dependent on the thromboplastin reagent or instrument used. INR values are used to monitor warfarin or coumarin therapy. There is no reference range for INR. The therapeutic range is dependent on the condition being treated, but is generally considered to be between 2 and 3. The formula for calculating INR is the patient's PT in seconds divided by the control PT in seconds. The ISI, or International Sensitivity Index, for the thromboplastin reagent is provided by the manufacturer and is specific to the lot number and instrument. The most sensitive thromboplastin reagents have an ISI value of 1.00, based on World Health Organization standards. Prolonged PT can indicate factor deficiencies in the extrinsic and common pathways, where factor activity less than 25 to 30% or warfarin therapy will prolong the PT. Sources of error include improper sample collection, improper preparation, and inherent patient problems. For example, a falsely long PT can result from the same issues as for APTT, and a falsely short PT can be caused by a small clot in the tube. Reagent preparation and instrumentation problems are the same as for APTT.